Now, Dr. James Smith is a medical doctor. He spent weeks working in Gaza and joins us live now from London. Dr. Smith, thank you very much for your time of speaking to us yet again here at TRT World. Let's go back to those new evacuation orders. The latest forced displacement orders span a huge area now. Just how concerning are these new waves of displacement, especially in southern Gaza?
This latest forced displacement order defies comprehension. The geographic area that has been subjected to this displacement order is huge. It's the northeast of Rafah, extending up to the east of Khan Younis. As you've already reported, we're talking about hundreds of thousands of people, many of whom have displaced, who are being displaced again. And those people are being pushed into the tiniest strip of land that is already containing more than one, perhaps even 1.5 million people. There is no space, there is no system to adequately meet the needs of the people of Gaza at this moment in time.
And this repeated displacement of Palestinians, what sort of effect will it be having on not only their health, but their morale and their mental health?
I mean, this is having a hugely catastrophically negative impact on everyone in Gaza right now, from a physical and psychological health perspective. As I've mentioned, we're talking about people and families who have been displaced multiple times, people that have endured or have borne witness to some of the most horrific violence that one could possibly imagine. And of course, a feeling of complete insecurity and abandonment by the so-called international community, which has failed to act accordingly to stop the violence that Israel is committing against the Palestinian people.
And you have a first-hand account of working at hospitals in Gaza. Can you give us a sense of what you were confronted with whilst there?
I was confronted with, on the one hand, the most dedicated and committed healthcare workers that you could possibly imagine. The Palestinian healthcare workforce, it was a privilege to work alongside them, but they were working in the most horrific conditions, hospitals that were perpetually overwhelmed, a complete lack of access to the most basic medical resources. Many of these hospitals for months now have been struggling to remain open. And now we're talking about the forced closure of one of the largest hospitals in Gaza, the European Gaza Hospital, which has led to the forced displacement, the preemptive fleeing of hundreds of patients, many of whom have complex medical and surgical problems, to the few remaining hospitals in the south and the center of Gaza. And that's Nasser Hospital, that's Al-Amal Hospital, and that's Al-Aqsa, along with the field hospitals. They are already struggling to cope. Every day they are responding to mass casualty incidents. Many of those hospitals are already far, far beyond capacity and simply unable to absorb the additional patients that are now fleeing from EGH.
Dr. James Smith, we really appreciate your time. Dr. Smith speaking to us live there from London.